All right, hello everyone, and welcome to our presentation on functional communication training and early start Denver model. We will be discussing these implementation strategies along with the materials needed for them, the background information, and much more. Our presenters, in no order, are Haley, Rachel, Chastity, Abby, and myself, Libney. So our objectives: introduce our group members, provide an overview of the case, understand the mixed intervention of FCT and ESDM, understand the implementation, and learn about the materials that will aid interventions. Next, each behavior consultant will introduce herself so that you get to know us a little bit more, and we will be beginning with Haley Calloway.
Hi, my name is Haley Calloway and I live in Connecticut. I've worked with children with disabilities for over 5 years, and for last year I've worked in an early intervention clinic for children with autism spectrum disorder as a registered behavior technician. I work with clients around ages 18 months to 6 years old and implement applied behavior analysis, which aims to improve socially significant behavior. I'm currently pursuing my master's to become a behavior analyst and work in early intervention.
Hi, my name is Rachel Oswald. I am an applied behavioral analysis master's degree student at Ball State University out of Indiana. I currently reside in Ocala, Florida. I have worked with children with disabilities for 10 years. The last 5 of those 10 years, I have been working as a registered behavioral technician in the ABA setting. I currently work with early intervention children ages 2 to 9 in an ABA clinic. Previously, I have worked with children 2 to 21 in a variety of settings, including school, home, recreation, and community. I aim to improve the lives of children with ASD and help them live an independent life.
Hi, my name is Chastity Casanova. I am in my 3rd semester in Applied Behavior Analysis Master's Degree Program at Ball State University. I'm originally from Brooklyn, New York, but reside currently in Muncie, Indiana. I've worked with children with disabilities for over 12 years in a school setting as an inclusion special education teacher, and then 8 years out of the 12 years as a registered behavioral therapist in an ABA clinic. I am currently working in an early intervention ABA clinic with children ages 2 to 8 as a BCABA, and work closely with a BCBA.
Hi, my name is Abby Zielinski, and I've had the opportunity to work with special needs children for over 10 years. I'm from and reside in Northern Indiana, and I am in my 2nd semester of graduate school in which I study applied behavioral analysis, or ABA. I've worked in a clinical setting with children ranging between the ages of 2 to 8 years old with autism spectrum disorder. And I work as a lead RBT trainer and therefore work closely with multiple board-certified behavioral analysts to further my education and continue toward my goal of becoming a BCBA.
And hello, my name is Libney Lopez. I have been an RBT for a year now. I work full-time at an elementary school and also a middle school, and occasionally do in-home sessions. After earning my bachelor's degree in psychology in 2020, I was not sure what I wanted to do, but I knew I wanted to work in mental health and make a positive impact on my community. When I became an RBT in 2022 and discovered ABA, I quickly realized that this is what I wanted to do for a long time. I also realized that I wanted to have a bigger role, and that's when I decided to pursue my master's in ABA to become a BCBA. Although a lot of this is new to me, I'm eager to learn, become a BCBA, and be the first person in my family with a master's degree.
So the overview for our project, we chose to look into Willow Preschool, and Willow is an inclusive preschool in an urban area. Approximately 50 of the preschoolers receive speech therapy. Half of the 50 preschool students who receive speech therapy are nonverbal, and 5 of those nonverbal students use PECS, or a picture exchange communication system. The remaining 20 nonverbal students occasionally point or grunt, but are not using any other communication methods currently. Willow has 24 classrooms and 8 to 12 students in each, along with a teacher and 2 assistants. In addition to the school staff, 4 to 6 volunteers are available daily from the parent volunteer program. Primarily, the volunteers support staff by taking students to the bathroom and making copies for teachers. There are 2 ongoing behavioral issues during playtime in every classroom. These are fights over toys and tantrums. In most cases, the problems occur when a student grabs a toy from another student rather than asking for it, or asking to play with them. Often this results in students fighting and/or one or more students throwing a tantrum. So for our training methods, we are going to talk about BST, or behavioral skills training. This is the training method in which we are going to help the teachers implement our other interventions. There are 4 steps to BST. The first step is the introduction of the skills. We will have the teachers introduce the skills to the students, and then we will have the teachers model the behavior that they want the students to emit. Third, the teachers will allow the students the opportunities to use their form of communication to tell their needs or wants. Finally, the teachers will reinforce the desired behavior or repeat steps 2 through 4 as necessary.
Introduction to ESDM and FCT. So what is FCT? FCT is functional communication training and has been seen to reduce aggression, self-interest behavior, and tantrum behavior. It requires one to know the function of the maladaptive behavior, and from that understanding of the function, a communication phrase can be chosen that is used as a differential alternative behavior, or DRA, which is taught to the individual and seeks to replace the maladaptive behavior. For that communicative response, it can be either vocally or using an AAC device or a textbook or hand gestures. It also can be applied to multiple settings, including in-home and in schools. What is ESDM? ESDM is the Early Start Denver model and is a behavioral and developmental model form of intervention appropriate for children between 1 to 4 years of age. Multiple studies have shown positive outcomes on the development of children diagnosed with autism. The video on this slide describes the ESDM in more detail, and feel free to watch this at a later time. The core principles of the ESDM are based on typical toddler learning development, increasing interaction and communication skills, teaching during natural play, and building and fostering positive relationships. Materials needed for ESDM and FCT. So a formal ESDM training would be necessary if you want to implement ESDM, and as well as needing to be certified in advance. Additionally, to ensure a high level of understanding, those that receive the training will need to score above 80% on an ESDM fidelity scale. This requires documentation of a video that you send that showcases the skills needed. When implementing the ESDM procedures, a manual will be made available for reference at all times. Paper data sheets for ABC data, as well as for discontinuous measurements, if you cannot continually measure, are shown. It's imperative that to implement those, you have access to paper and pen and computer to ensure everything you have is recorded to look back on. When implementing FCT, ensure the clients you are implementing intervention with have any additional communication device on hand. For instance, a textbook as shown to the left of the PowerPoint slide. Implementation. To implement FCT and ESDM, you need to conduct a functional behavioral assessment, which includes taking ABC data. The materials needed will vary on the function of the behavior and the form of the communication that has been determined. For instance, ABC data will be appropriate for tantrum data, as well as the duration of the tantrum episodes to work out the function. An ABC data collection form is shown on this slide. A preference assessment should also be undertaken to ensure you find items that are reinforcing to the client. This is important when working with the client and teaching the communicative response, because you want to reinforce when they correctly respond with that communicative phrase, as well as appropriately playing with their peers during an ESDM workshop. ESDM versus FCT. ESDM teaches social skills through play, and part of these social skills include taking turns and asking for items. FCT teaches a chance to communicate all wants and needs in any setting. By combining FCT and ESDM, we will use play to effectively teach the students how to communicate their needs and wants, as opposed to engaging in maladaptive behaviors.
FCT implementation. Steps for implementation. 2 to 3 times per week, spend about 30 minutes per student sitting with them and going over FCT implementation, being able to functionally communicate their needs and wants. Easily understood phrases and low effort for the children to replace the behaviors such as using a my way by tapping their chest with their hand, or picture exchange communication systems can be used in place of verbal language. Proactively use the phrases or gestures as soon as you see the children go to reach for an item or touch an item. Provide verbal praise and access to the item when they respond appropriately. Slowly reduce the amount of times you say the phrase my for my way to see if the child repeats. To fade phasing for gestures or pecks, slowly reduce from full physical prompting to partial physical prompting, then change to a gesture or a visual prompt. Reduce all prompting and see if the child uses the phrase independently. If they are able to independently use the phrase or the gesture, praise immediately. If they still need prompts, go back in and repeat as needed. Benefits of FCT. There are multiple benefits of FCT. Extensive research has been conducted on FCT, and it has been seen to replace the challenging behavior to a functional response. The research has been conducted across multiple individuals and age groups and settings, and there are significant benefits to FCT. For instance, it reduces challenging behavior as well as increasing the expressive communication repertoire and the individual has. It also fosters relationships with peers and adults due to the ability to communicate what they want. Moreover, FCT teaches the children and clients to functionally communicate their wants and needs, as well as reducing frustration in clients as well as individuals they interact with, because they can communicate what they need. ESDM implementation. Steps for implementation. Conduct a functional behavioral assessment on the challenging behavior to determine the function. 2 to 3 times per week, spend about 30 minutes with the students in small groups, roughly 2 to 3 kids. Engage in simple play games that require turn-taking and sharing. Contrive natural opportunities for turn-taking, such as giving items to one peer and having the other peers request it. Provide full phrase for a peer to ask for item or shadow hands to wait their turn. Provide verbal praise and access to the item if the appropriate response was omitted, and if the student engaged in tantrum behavior, their correct response would be modeled, such as, I want a toy. Again, you can also use hand gestures such as my turn with your open palm on your chest, or picture exchange communication systems. Once a child is responding to you, fully prompting response start to fade away and allow the child the chance to respond independently.
Benefits of ESDM, multiple studies including children of all types of learning abilities, specially trained therapists lead sessions incorporating ESDM, childcare setting and looking into training parents to deliver in-home ESDM. Benefits include improved learning, improved language abilities, more appropriate adaptive behaviors, increased brain activity, and areas associated with social and communication skills. School-wide implementation, usage of grants for materials including workshops, utilization of all personnel that are trained on the programs will participate in implementation. Teachers, paraprofessionals, and volunteers will be implementing these procedures. Funding streams, grants, Individuals with Disability Education Act, also known as IDEA, Local Education Plan, also known as LEAP, ESDM workshops at $425 per person.
So lastly, we have our data collection procedure. To ensure the intervention is working, the staff at Willow Preschool will take momentary data for 2-minute intervals for 10 separate sessions, pre and post intervention, to compare whether the intervention is working. They will state whether tantrum behavior is occurring in that moment, and the number of intervals will be examined. If the percentage of intervals whereby tantrums occur is lower post-intervention, it is likely that the intervention was successful. And here we have a snippet of what that would look like on the sheet, the data collection. And lastly, here is our conclusion. First and foremost, FCT and ESDM interventions are successful at reducing challenging behaviors, including tantrums. Interventions will also aid in increasing communication skills amongst the students. With the proper implementation, Willow Creek is ensured to have effective outcomes, and at the end of the intervention, Willow Creek Preschool is expected to be a more cohesive unit. Thank you for listening.
References.